How come it didn't say it's, there we go. Hey everybody, Mac Atkinson here, and along with Tim, Cheryl, Dolphin, and Judy, we want to welcome you all to our next call in our Heart Health series. And this time we're going to talk to you for a little bit, if we can, about oral care and the importance that it brings in terms of our heart health. Before we do, we are going to be talking a little bit about some Sunrider products as we normally do. So I just want to remind everybody that none of the information provided in this presentation is intended to represent a diagnosis or a cure of any illness or disease. For anybody new watching this presentation, or for those that just wanted a reminder and hear it from me for the 5 millionth time, I'd like to share with you a little bit about why Sunrider is certainly important to me and why we think it's probably the best opportunity out there for you too. First of all, Sunrider's been around for over 42 years, which represents stability in our industry. There are very few companies that have been around as long as Sunrider. Sunrider operates in over 50 countries around the world, and if you've heard me say it once or 1,000 times, again, that's one of the reasons I love being in this company, is the ability to travel around the world a couple times each year, to be exposed to other cultures and other people. And I love the fact that I get a chance to do that. Coming from a manufacturing background myself, pharmaceutical manufacturing in particular, this next thing really was important to me, and that is that Sunrider internally handles all the research, development, and manufacturing of its products. Now, again, folks, you have to understand the common practice in our industry is for a company to take a recipe to a third party and say, make my product for me. They have no control over the research, development, or manufacturing of it. That is not the case in Sunrider. We handle all of that internally as they manufacture over 400 of what I feel are the most incredible health and wellness products on the market. Everything from whole food nutritionals to cleansing beverages to weight management, sports and fitness, green household, and all natural skincare and cosmetics. Now, again, what makes these things so unique is they come from what we call our philosophy of regeneration. And Cheryl, if you can please pick us up and talk us to us a little bit about what that means to you.
Thank you so much, Mac. Yes, Sunrider products are based on a simple yet powerful idea, and it blends the traditional Chinese medicine with advanced Western science. And it is our philosophy of regeneration. And it's really what got me into Sunrider. When we nourish with only the finest natural ingredients and cleanse of harmful chemicals and artificial colors, flavors, and preservatives, we bring our body into balance, and a balanced body is a healthy body. And Dr. Tei-Fu Chen, the founder of Sunrider, says, the philosophy of regeneration reflects the core concepts of his knowledge and beliefs and is the blueprint behind every Sunrider product. And there's 4 guiding principles to the philosophy of regeneration. Number 1, nourish plus cleanse equals balance. And Sunrider products nourish the yin and cleanse the yang, your body's 5 systems to promote balance for optimal health and energy. I'm sorry, can you guys hear my blue jay or stellar jay? I'm sorry.
Okay.
Number 2, clean foods, not chemicals. Our products are made with nutrient-rich whole foods and herbs, not synthetic, artificial, or highly processed ingredients. Number 3, we need a variety. There's no perfect one food or one ingredient. Too much of anything can unbalance the body, even damage our health. And our products give one vital variety of wholesome ingredients. And number 4, the expertise in formulation and concentration. And this to me is one of the most important. While most companies outsource manufacturing, we control every aspect, as Mac mentioned earlier, and we personally ensure the potency, purity, integrity, and safety. And with that all said, Judy, tell us a little bit about our oral health.
Okay, well, thank you, Cheryl. The interesting thing, I don't think any of us doubt that there's some connection, because oftentimes going to the dentist, they ask if you're having some major dental work done, they might ask you if you're on any heart medications or how is your heart, or they might want you to take an antibiotic before the oral care. So, way back there, we kind of get a semi-connection, but it's really eye-opening to see how connected they really are. And one of the things you don't want to hear from the dentist is that you have periodontal disease, which means advanced gum disease. And this is caused by a bacteria in the mouth, which then creates an inflammatory response. And this can contribute to actually atherosclerosis, which is hardening of the arteries. And we all have heard that term. If we have any older friends or relatives, or just it's a constant conversation. So that's something to be aware of. And the same bacteria, which can create oral infections and this gum disease, if gone unchecked, that bacteria can enter in the bloodstream and actually cause things like Streptococcus mutans, and another one that is related to gingivitis. It's a bacteria with gingivalis at the end of its name, a big word. And so that bacteria can stick to actually damaged heart valves. So that increases the risk of infectious endocarditis. Now, this isn't designed to scare you, it's to motivate you to see it's a serious connection, not just a surface one. And we know chronic inflammation can cause things like heart disease and strokes, and you're much more likely to have that when you develop chronic inflammation. Also, have you heard that CRP? No, it's not an abbreviation for another word. It's C-reactive protein, and that's related to both periodontal disease and cardiovascular. So when you get a blood workup, and if that appears out of the normal range, it can be one or the other. So that alone connects them. Now, what are the risk factors that both contribute to? What contributes to this? Smoking, diabetes, poor nutrition, and chronic stress. Also, here's a statistic you might be interested in, that people with periodontist disease are they're twice as likely to suffer from heart disease or strokes. And so, again, not to scare you, but to see the connection. And we're talking about heart, and who knew the mouth had so much to do with the heart? So again, we're making connections with the body parts, building on the seasons, and how they all rely on one another. So what can you do for yourself? You can brush and floss daily. You can get regular dental checkups. You can avoid tobacco products. And you can manage the other health conditions that are similar in nature. Kind of like, did you have chicken or the egg first? So if you have diabetes and high blood pressure, you need to keep close watch on your mouth, and vice versa. You want to deal with each of those in a proactive fashion. So this is the condensed version of the connection. But Fen, we're interested in traditional Chinese medicine. So can you share with us the connection from a TCM standpoint, between oral health and heart health?
Absolutely. Thanks, Judy. So from our last call, you'll remember that I listed off different characteristics of the heart season, the summer season, which is heart and small intestine, and the organ that is related to the heart season is the tongue. And what's interesting about the tongue is that it is the window of the heart. It's the only organ that is outside of our body. It's an organ that we can actually see. All the other organs are, of course, inside of us. And you can get a lot of information from looking at the tongue. So Mac has this great picture here at the bottom left corner. And within the tongue, just like in the eyes and the ear or reflexology in the feet, you can see there's a map for all the organs within the tongue. Now, today we're talking about the heart. And so the tip of the tongue relates with the heart. And you're going to essentially look at the color, the shape, and the coating on the tongue, which will give you information about if things are in balance or out of balance. And also with the teeth, what's interesting is that the meridians all align within the teeth as well. So for the heart small intestine, the pericardium, which is the chamber around the heart, and the endocrine glands. We focus on the third molar on both the upper and lower jaw. So that's something to pay attention to as well. Whether you have maybe some pain in those molars or maybe you have cavities or things like that, will directly relate to the meridians that correlate with the heart. So I love the fact that we have all these different tools and diagnostic ways of checking out the body through Chinese medicine just by seeing and feeling the different aspects of our body. And so, moving on, Mac, you're going to talk to us a little bit about that awesome topic of nitric oxide.
Thank you, Finn, and thank you, Judy. You're right. It is. In our last call, we talked a lot about nitric oxide and the impact it has on our heart health. And one of the things I found interesting, and especially after hearing what you had to say, Judy, about poor oral hygiene and the bad bacteria that can happen in your mouth and what it does to you. Well, the good bacteria in our mouth, which comes from proper care and the things that we'll talk about in a second, actually really help us in terms of nitric oxide production in our body. And it's kind of interesting where the mouth is almost like the first factory floor for nitric oxide production. And for those that don't know, I mean, Dolphin, on our last call, you shared with us a number of table foods that are wonderful in terms of creating nitric oxide in our body. I mean, leafy greens, beets, celery, those kind of things. Well, as we eat those are actually nitrates. And what happens is once they enter our mouth, the good bacteria begins immediately to create them, to change them into nitrates. When, as we swallow then these wonderful foods, both our stomach and our blood then takes those nitrates and converts them into nitric oxide. And again, listen back to our last call where we talked about all the great things that nitric oxide does for the body, including heart health. But again, folks, this is something that I was just kind of blown away with. I hadn't realized that the minute something goes into my mouth is when this process starts in terms of both digestion, which we'll talk about next month when we get into Earth Element, but also the creation and the production of nitric oxide. So again, what can we do? Judy, you referenced some of these, so did you, Finn. I mean, again, daily brushing, flossing, cleaning your tongue, making sure it's a healthy surface, and again, continuing to eat those wonderful nitrate-rich foods that help us create the nitric oxide naturally in our body. Now, instead of talking as we normally do in detail about the products, I just wanted to share with you guys a little bit about some of the things that Sunrider has that help us with our oral care. And then what we're going to do is we're going to stop sharing and we're just going to share stories a little bit with you about what each of us have experienced in this area. But everything from our SunSmile herbal toothpaste, our whitening gel, our SunSmile refresher drops, as well as things like Vitadophilus, Sunbreeze oil, and our SunSmile fruit and vegetable rinse. So with that, I'm going to kind of get rid of the PowerPoint here and let's just come back, if my computer will cooperate and stop sharing, to our gallery view. And, for me, if you guys don't mind, since I'm already talking, I might as well tell my story first, right? I had an opportunity and I've been able to travel with Dr. Chen many times in the last 20 some odd years, but specifically, I remember about 15 years ago, I think it was 2010, where he and I and a couple of other larger leaders in the company had an opportunity to travel together around the United States. And I found it funny because Dr. Chen, when you travel with him and you're going to various cities, his talk is pretty much always the same. He picks a topic, he sticks with it, and that's what he delivers in each of the cities you go to. And I was kind of blown away on this particular trip because his focus was all about our toothpaste and how incredible it was. And now, again, okay, I had been a Sunrider product consumer for a while at that point. I had been using the toothpaste, so I truly thought it was incredible myself, but I hadn't realized why it was so incredible until I started traveling with him and hearing the story in each and every place. And one of the things that kind of sets this up is I did do a little research. And, when you look at commercial brands of toothpaste, And I was blown away by this. I hadn't realized that probably 50 to 60% of every commercial toothpaste is actually fillers in a base. It's sorbitol, it's glycerin, it's water for bulk and texture. Another 30% is humectants, things that help the toothpaste from drying out. And then there's about 3% that are flavoring sweeteners, in colors that they add into the toothpaste. And so that leaves anywhere from 0.1% up to maybe 5% in a commercial toothpaste that is actually nutritional products. Okay. Quite the contrary with Sunrider. We are 100% nutrition. And that's because Dr. Chin recognized all this. On the trip, he talked about 4 things that he would never have in our toothpaste. Things like sodium lauryl sulfate. He said, this is a shampoo. It's a harsh chemical that's meant for your head, not for your mouth. Okay. We talked about fluoride, and I know there are various opinions on fluoride. I happen to be in the school that says, thank you, no fluoride for me. As a matter of fact, that's a conversation I have with my hygienist every 6 months when I see her, because she is a fluoride person. Maybe that's one of my big Sunrider challenges. And next time I'm going to get Lalani converted over. In any case, he talked a lot about fluoride and the negative effects it can have on our bodies in so many different ways. He talked about sodium hydroxide, which is used to create an alkaline pH in the mouth and clean the particles between the teeth. But again, it's a harmful chemical. And Cheryl, as you said, we're all about natural ingredients, not about chemicals. And the last he talked about was waxing agents. He goes, yeah, they put waxing agents in these toothpastes. It's like you can polish your car with this darn stuff that they put in most toothpastes. So again, the bottom line, these are all reasons why, at least here in the United States, almost every commercial brand of toothpaste has that disclaimer on the back that says, if you swallow this stuff, you better get to a doctor. Sunrider is made with baking soda, herbal enzymes, and herbal extracts, including neem tree oil and peppermint oil. 100% natural, 100% nutrition. So that's enough from me, I think. Who's going to tell a story next?
I think I am, Mac.
I think you are. Cheryl, jump right in.
Okay, I love our toothpaste. The ingredients I love. I love that you use very little, a pearl size on our toothbrush. I love how economical it is. It's safe for children. I have so many nieces and nephews, they love it. For me, how I use it is I use a pearl size of the toothpaste, a pearl size of our whitening gel, and a dab of our refresher drop on my toothbrush, and give my teeth at least 2 minutes of brushing. And then I love to put a couple of drops in my water pick, and I water pick my teeth with the refresher drops. And then I squirt refresher drops on my teeth, and I take the dental floss and floss my teeth. So when I go to bed at night, they are clean and fresh and bright. And every time I go to my dentist, every single time, they rave about how healthy my gums are, how bright my teeth are. They say you lose your enamel as you get older, and I'm 75, so I've lost a lot of enamel. But they said your teeth are so bright anyway. And so that means a lot to me, because less dental bills, nice smile, your own teeth. Who could ask for more?
Perfect. Perfect.
Thank you, Mac.
Great. Tim, are you
And
next, or who was going to jump in? Finn, you're next. Who was going to jump in next?
Sure, I'll jump in.
I'll be right.
Okay. So yeah, I have a couple of stories. One, of course, is I've told a story about my introduction to Sunrider's SunSmile toothpaste and how nervous I was as a young 20-year-old, because I was definitely brainwashed by the whole fluoride has to be a part of the healthcare, the oral care. So I was really nervous when I started, but what was interesting is I had cavities prior to using SunSmile. When I would go to the dentist, they kept on saying that my gums were receding and that um, I was prone, in the future, I probably would have gum disease or have to, have surgeries and things like that. And what's interesting is that, and actually just from our calls, I just kind of put this together, is also I had chronic yeast infections as a young woman, and I had an eating disorder at that time. And so what was interesting is when I transformed all of that, I started using SunSmile, loved it. Like Cheryl said, I mean, your teeth feel like pearls, like just the sense, there's no abrasiveness in the toothpaste. And so it's beautiful. But I also used, of course, the Vitadophilus and the Nuplus, and just changed up my eating habits, which helped me move past having an eating disorder. It helped move me past having yeast infections, and so I have never had a dentist appointment where they've ever talked about my gums since. I never get anything about receding gums. I've never had a cavity since. I'm 58, and since my 20s, that's when I had all my cavities and things. I haven't had any since then. So, yeah, and I've had clients that use the toothpaste. And what's interesting is that a couple of them ran out and they were traveling and things, and so they just picked up some commercial toothpaste, and each one of them, their comments were either that it burnt their mouth, like they felt like their mouth was on fire, or that it created a lot of sensitivity on their teeth. And so we know that that's another thing, right? That this whole sensitive teeth phenomenon, and they come out with toothpaste specifically for that. And I have clients that have had sensitive teeth and they swear by SunSmile, like it took away all those kinds of sensations. And one other thing that I just thought about, again, just I love these calls. I'm always learning something. But think about how, especially for women, when they are having a heart attack or having symptoms of that, it's not like men where it's the typical down the arm kind of sensation. I know this from my mom, not is that indigestion. They feel like it's all in the gut, and they feel like they're nauseous and they're not feeling good, or they have, and it's just like, and it can be related to what's going on in the heart. So there is definitely this link between the heart and small intestine and digestive system. So those are just a couple of the stories that came to mind for me today. And Timsky, what do you got for us?
Nothing, those are awesome. Everything is so awesome. I'm going to keep it kind of simple just because I was so into Sunrider already by the time the toothpaste came around. But it was still, there's always an aha moment with some of all these wonderful products. I mean, I've got an aha moment. And I guess, first of all, like you've all three of you shared already, is compliments from the dentist going, your gums are amazing. I had a couple of issues with teeth, but right now, nothing. And again, your teeth feel so good. And I know what I'm doing. I guess what's interesting is I have a couple of clients one of them's used to be the dean of dentistry and of the College of Dentistry in Saskatoon here. And he's using it now and just loving it, which is pretty cool. I'm blown away by the ingredients and the fact that he was a proponent of fluoride, and now he's kind of like, no, I understand what the heck's going on here, and did a little bit of his research on his chemistry. So pretty exciting stuff. And but just I love how it feels. And you know what? Here's the trick, the ticket. Sometimes you kind of take it for granted. Yeah, I got my toothpaste. It's SunSmile toothpaste. It's awesome. Because when you run out and we had a little stretch there, we didn't have any for a bit. Not long, but we didn't have any for a bit. And then you try anything and everything. And I used to use another brand. I won't start mentioning brands out here, but that was always a pretty decent brand, and had health ideas into it, but it was nothing, and nothing came close. And I was just like, it felt like my mouth was deprived. And as soon as the SunSmile came back, what a luxury to realize. It's essential, but it's an essential luxury. But in comparison to anything else out there, it feels so good. I love brushing my tongue and my gums. And what's interesting is my dentist crew, they show me how to brush your gums properly. And it's just with the soft bristle toothbrush. Everyone thinks you need the firm. No, you don't need that. You need it soft as you can. And you go very gently over your gums. And when you're using SunSmile, like my gums, it's like they're giggling while I'm brushing on in there. And I think it shows. I love going to bed, having that freshness, and especially first thing in the morning, taking that layer off. I mean, this isn't the most elaborate story, I guess, but it's just my own personal experience. I won't have anything else. And I love how Cheryl put it too. I love that little pearl size, and I like using a drop of the Sun Smile whitener, and then again, I've just made. You actually inspired me on this too, Cheryl. I put in a drop of fruit and veggie rinse too. I let my toothbrush sit with that on the side, but I like putting a drop in with it as well, and it's just that much extra freshness. But just a little bit about heart health, and I've been playing tennis, and I know I throw it in there all the time, but it's 5 days a week and it's intensity, and playing with some guys that can really go. And like today, I was out there today and getting worked hard and being able to go 100%, and I'm feeling my heart pounding and my heart rate's going up. I wear an iPhone watch or an iWatch once in a while just to see what my heart rate is, but it was going up to 160, and I felt like it was nothing. It felt fantastic, but back to that heart oral health connection, it's like that's just one more sign and more symptom that things are going really well inside, and I could feel my circulation so well, and moving so well and without any inhibitions, and recovering from injuries too. Like I know that they're all connected, right? And that's why little things like the proverbial tennis elbow. Like, and today I went out today and I had zero pain in there, and there's been some times where it feels somebody's life and it's pretty bad, but today I had no pain today, zero. Anyway, that's my story, and I think Judy has a little something for us too.
Well, I don't have gums a giggle, nor have I ever been one to be flashing my pearly whites, but I certainly appreciate hygiene, having clean mouth, and all of that, and greatly appreciated when we received the dental care program. But a number of years back, I went to the dentist, that I drop in every so often, say hey. And the hygienist, they measure and they give you scores, and she goes, oh my, and I'm thinking, oh brother, get on with it. But she says, I think we need to do some gum scraping. I said, what exactly do you mean by that? Because I was thinking she can't possibly mean me. And she said, well, I think we better start this. It's not severe, although when we get in there, if it's severe, we're going to go all the way down. We're going to scrape those gums. And I said, I mean, the thought of someone's hands longer time in my mouth, and just the very fact that she was saying that was tremendously alarming. But I said, well, thank you. That's good to know. I said, I prefer to deal with this in the next few months, and then we'll check again. Because I had no idea. And she said, well, just a minute, and she goes and gets a little more seasoned hygienist. And I'm just totally appreciative of this woman, because she came in and she started questioning me, what do you plan to do? And she said, and have you been under chronic stress? And I said, interesting that you mentioned that. I said, yes. But who isn't? I said, but my father passed away recently. We had to fly back. It's been a long process. And she goes, oh, well then. She goes, what are you going to do? And I told her, I said, I'm aware that golden seal root is very healing for the mouth and gums. I said, I have excellent toothpaste and bacterial care. And I just want to give more attention to it, because don't get me wrong, it's not that I didn't brush every day, but again, I've never smoked. I don't have diabetes. I have good nutrition, but hey, I have chronic stress. And whether it's my perception, but it was bigger than usual. And so she goes, you do that and then come back. And when I came back, I didn't need any of that. And so again, I'm never saying disregard that, because we've obviously established it's very serious if you have something like that. But why not jump ahead, take it more seriously, and get on the preventive side? Because we have the tools, and now hopefully we see the importance of the connection. And all of us have one little thing that motivates us more. Getting this information and sharing it is definitely motivating, and thinking back on the past. But this little fact really got to me, and I just want to share it. And I think it's appropriate. I found out just this week, as looking through information and trying to be prepared. Did you know there are 40,000 brain cells in your heart?
Mhm.
And I didn't know that. We know about a heart, brain, and listen to your heart, or don't listen. The heart is treacherous, or out of the heart's abundance, the mouth speaks. But again, the mouth, the oral care, the heart is figurative and it's literal. So whatever floats your boat, incorporate that and give attention to this, because it's one of the puzzle pieces to good health. Mac, what can you add to that?
You know, nothing. Those stories were absolutely fabulous, you guys. I mean, I love hearing this, and I'm so glad we kind of took this approach in this particular call on sharing stories like this and our experiences. And like all of us have said, I mean, I learned something with all of these calls too. And Judy, I'm glad you mentioned that heart-brain connection. That's something we'll be posting about on the 5-Element site, as well as we'll be posting about all of the various products that we showed you on the screen and referred to in our conversations. And Judy, back to you again. I hadn't realized until you mentioned it, and now it makes perfect sense. The Chinese golden seal root would be a perfect addition as well in terms of our oral health and how it can help all of that. So thank you for mentioning that. And I guess, again, great stories, Judy, Tim, Dolphin, Cheryl. Appreciate you guys sharing the way you did so much. And look, for everybody listening in, we'll have we're probably going to do one more call for the summer season before we move on to late summer and getting to Earth Element. And what we had talked about coming back to you with was a call associated with collagen, minerals, and electrolytes and how they impact the heart as well. So that'll be the last one you'll see from us in this particular season. But again, from all of us, we just want to thank you so much for tuning in. We hope you got value out of this call, because I know I sure did, just listening to all you guys and your stories. And as always, thank you so much for joining us, everyone.
Bye.
Thanks, everyone. Bye.